Dear learners, welcome to this MOOC on Sociology of Health and Illness. I am Maureen Kalita, Assistant Professor from the Department of Sociology, KKH-SOU, and today we will be discussing the unit on Social Epidemiology from the second module titled Basic Concepts. So after going through this unit, you will be able to learn about epidemiology and social epidemiology, understand the development of social epidemiology, discuss the perspectives surrounding social epidemiology, then again understand the relation between social conditions and health, and lastly, we'll also discuss on the methods of epidemiology. So what is epidemiology? This epidemiology is a branch which involves the studying of frequency, distribution, and determinants of health-related events in specified populations, as well as its application to the prevention and treatment of health issues. Epidemiologists examine the 5 W's. What are these 5 W's? One is diagnosis or health event, which is called what, from what we will understand, and then comes the person. It signifies the who of the 5 W's. Then comes the place, in other words, the where, and the time, that is when. And lastly, the causes, risk factors, and modes of transmission that accounts to the why and how. So, epidemiology is based on the assumption that disease, illness, and ill health are not dispersed randomly in human populations. It proposes that each one of us possess some features that predispose us or protect us from a wide range of diseases. These traits could be predominantly biological in nature, or they could be the result of exposure to particular environmental risks, or both. Now we will give a brief on the development of epidemiology. It was basically in the 17th century when efforts were made to understand and predict disease, which motivated the documentation of disease symptoms, outbreak patterns, and patient outcomes. In 1662, John Grant, he was a statistician, while trying to understand the outbreak of bubonic plague, found out differences in death rates based on sex and residency patterns. On the basis of the results that he found, he also published natural and political observations made upon bills of mortality. He published this and thus established the field of epidemiology. However, epidemiology only became a full-fledged science in the 19th century. The major push for epidemiological studies came with John Snow. He was a young surgeon and pharmacist from Newcastle who worked on cholera and the spread of cholera. Snow's research on the causes of cholera deaths led him to a water pump located at the center of the epidemic. He further examined the sample water taken from these pumps under a microscope and found that it contained white flocculent particles. So from that, he concluded his investigation and said that the water from these pumps was the source of the infection that was happening to the people surrounding the area. So the removal of the pump dramatically stopped the spread of cholera. With Snow's intervention to combat cholera, epidemiology reached new importance in the disease intervention. Until the mid-19th century, studies were conducted with the assumption that it was mostly societal conditions that affect physical health. For instance, if we talk about Frederick Engels, in 1844, he described the working conditions of the factory workers in England. Through observation, he witnessed the horrible working conditions and identified the relationship between these conditions and diseases, thus motivating him to write the book the condition of the working class in England in 1844. The long working hours, along with the dingy facilities and environmental hazards, caused ill health and malnourishment in the workers, thus showing the importance of social conditions in analyzing these health issues. However, the documentation of and attention to the impact of society on the body lost track as a concept of germ theory gained popularity in the 1860s. In germ theory, what happened was the germs were considered the major cause of diseases. In the 1880s, Robert Koch, he identified the organisms that cause tuberculosis and cholera. So, germ theory is considered to be a milestone towards disease prevention in the history of public health. So, when did social epidemiology as a branch emerged? As a branch, this epidemiological study, social epidemiological study is relatively new. Social epidemiology has developed by refocusing on its traditional perspective with contemporary epidemiological methods to understand disease etiology that includes social experiences as direct causes of diseases. So you can see how again the social has come to the context of understanding the health and the diseases caused in an individual or a group. In a backlash against the strong individualism of modern epidemiology, social epidemiologists argued for the need to return to the traditional epidemiological theme, that is, how do social conditions produce patterns of health and disease. Berkman and Kawachi, they were social epidemiologists and defined this branch as the branch of epidemiology that studies the social distribution and social determinants of states of health. Social epidemiologists, they claim that once exposed, the susceptibility to disease and mortality from the specific virus was dependent on social status, noting that the poor were less able to fight off even the minor infections. For instance, if we take the case of an epidemic like COVID-19, it is more challenging in countries with a high or larger population, limited health infrastructure, high poverty rates, low socio-economic conditions, poor social protection system, limited access to water and sanitation, and inadequate living spaces which are necessary to maintain the physical distancing and other required measures to contain diseases like this. In the early 1940s, Allende argued that social change and efforts towards creating a more egalitarian society are the only effective approaches to solving the health problems. Accordingly, he identified national development as a critical determinant of health, a theory that laid the early groundwork for the creation of the Human Development Index in 1990 by Amartya Sen and Mahbub-ul-Haq. The pattern of certain diseases can also be observed differently in the more developed countries. For instance, by 1950s and 1960s, chronic diseases such as cancer and lung diseases were becoming more frequent in the developed countries where infectious diseases were better controlled. Clinicians and epidemiologists monitoring these conditions, they realized that chronic diseases are caused by a combination of biological, social, and behavioral exposures leading to the creation of differential risk patterns for various populations. To reduce disease-specific mortality or susceptions, complementary strategies for prevention, management, and treatment of diseases linked to geographic distribution of disease, risk levels of diverse populations, and fundamental causes of disease, these aspects are needed to be evaluated. Thus, by the end of the 20th century, social epidemiology gained wider prominence. It started integrating the concepts and methods from different disciplines like anthropology, biology, sociology, political science, public health, psychology, and others to understand the health and diseases. Now, after discussing the concepts of epidemiology and social epidemiology, let us come to the perspective surrounding social epidemiology. So, there are various perspectives surrounding social epidemiology, out of which the first is the biopsychosocial paradigm of social epidemiology. Now, this perspective holds that organisms' biology is shaped by multi-level interactive environments. Diseases are thought to be the result of interaction between societal, individual, and biological elements. Then secondly, we talk about the population perspective. This is another important concept. According to Geoffrey Rose, an individual's disease risk cannot be separated from the disease risk of the population to which he or she belongs. Then thirdly, we talk about the multi-level perspectives. This aspect has aided in the development of social epidemiology by allowing the epidemiologists to conduct quantitative and structural assessment of social factors that affect the health of an individual. Now, we come to the next subtopics in which we will talk about the ways in which society enters the body. Now, what is that? Human bodies, as we know, belong to and are the products of the society in which they reside. We are born at a certain historical period and experience life according to our temporal context. Each historical period is marked by its economy, political, and legal system as well as the existing technology. We thus cannot divorce our bodily development from the systems or the temporal context we are born into. With processes like globalization, urbanization, and so on, individuals also move across geographically with greater speed than ever before. Along with this, various stages of an individual's life are determined by class, gender, race or ethnicity, sexual preferences, and so on. In all this perspective or all these cases, society enters the body during these developments. Our immunological responses to bacteria, lifestyle choices, and so on are also impacted. We may be exposed to infectious diseases like influenza, HIV/AIDS, malaria, etc., or chronic diseases like depression, diabetes, thyroid, drug addiction, and so on. So what is the work of social epidemiologists here is that they argue whether or not we suffer from and survive these diseases is heavily dependent by our place in the society, in what social context or what social environment we reside in. Everything plays an important role to determine the cause of the disease. Social epidemiologists refer to the life course theory to explain the phenomena by which these multiple factors interact to increase the susceptibility to disease. Some of these factors can be the geography and the living conditions of individuals. For instance, in developing countries, maternal mortality may be linked to poverty, wherein young girls are likely to have unplanned pregnancy. When childbirth occurs before the reproductive organs are fully developed, it leads to major complications resulting in maternal mortality. Then comes the socio-economic position. In every society, socio-economic status influences our health patterns. The variations are very high in the most unequal societies than compared to the relatively egalitarian societies. Whereas the job of the sociologist is to explore this in terms of social stratification, social epidemiologists aim to explain its influence on the health of individuals. For instance, studies show that children from families of higher social economic status have a 50% lower risk of asthma than children from families of lower socio-economic status. Then we come to the concept of income inequality and health. This is another factor which affects the health and the social environment related to us. So unequal access to resources, power or services affects satisfaction with life, morbidity and morality. So studies have found worse health outcomes in societies with greater inequality or in which the majority of wealth is heavily concentrated among a small elite section. Income inequalities are further exploited in comparing health expenditures across or within the countries. People in developing countries are responsible for paying a great portion of their healthcare costs compared to those living in developed countries. In developed countries, what happens is that the social, public and private insurances protects its residents from excessive expenditure in healthcare, unlike in developing countries. The next factor is on social discrimination and health. The evidence that discrimination affects health is very compelling. For instance, although women live longer than men, women have high rates of illness and disability. Also, individuals belonging to the LGBTQ+ have higher rates of smoking and suicide and substance abuse. This discrimination, which happen in the society, as we know, can be overt or covert. In addition to the socio-economic status, societal value of an individual is determined by race, age, sexuality, gender, and the other factors. Discrimination may affect health through economic and social deprivation, increased exposure to hazardous conditions, socially inflicted trauma, inadequate health care, and resources. In the US, racial and ethnic health disparities increase mortality and undermine health concerns. A study pointed out that poor black infants have the lowest birth weight in the US that sets children up for increased morbidity and mortality. In some regions where gender inequality exists, women are less likely to seek care and purchase medicines as compared to men. So we can see how these disparities affect in the health of different sections of the society. Next, we come to another perspective, which is on social integration, social networks, and health. Social ties and connectedness to family and friends also impact one's health. How is that? So studies have shown that people who do not have social ties are at a higher risk of dying of heart disease, cancers, etc. Thus, our social support also plays a great role in promoting health. Support may be in the form of financial, informational, emotional, or functional support. An individual's social relationship have both positive and negative impacts. For instance, a non-smoking teenager who hangs out with a group of teens who smoke can also begin smoking. Or in another case, if the parents of a newly diagnosed diabetic child join a support group, might learn how to manage the child's health condition with ease. Social epidemiologists thus look in detail how the behaviors and health are affected by various membership of social communities. Now we come to ecology and disease. From the discussion till now, we can say that human disease does not arise in a vacuum. It results from an interaction of the host, which can be a person, the agent, that is the bacterium, and the environment, that is a contaminated water supply, as in the case of John Snow's study. Although some diseases are largely genetic in origin, virtually all disease results from an interaction of genetic and environmental factors, with the exact balance differing for different diseases. Humans have generated new health concerns for themselves by constantly altering their environment or ecosystem through activities such as urbanization, industrialization, deforestation, land reclamation, and the construction of irrigation channels and dams. So from all these developments, infrastructural developments or environmental changes which are happening, we can see that climate changes, for instance, how it is affecting the health of individuals. So all these aspects of the ecology needs to be taken into account. The greatest threat to the health of humans in India today, for instance, is the uncontrolled urbanization, the expansion of slums, and environmental degradation. Man's intrusion into ecological cycle of diseases has resulted in zoonotic diseases such as rabies, yellow fever, monkeypox, Lassa fever, and so on. If we talk of an instance, we can relate to the 1984 Bhopal gas disaster, which demonstrated the dangers of placing factories in urban areas. We all know the consequences of what happened. So, ecological conditions are also very necessary to understand the pattern of disease formation and also to understand the health of the individuals living in that area. Now we come to the next section on epidemiological methods. The major concern of an epidemiology is to investigate illness occurrence in people who are exposed to a variety of factors and conditions throughout their lives, some of which may play a role in disease causation. To investigate this disease causation, an epidemiologist uses carefully designed research methodologies like observational studies and experimental studies. Observational studies allow nature to run its course, with the researcher taking measurements without intervening in the process. Under observational studies, there are two subgroups, which is descriptive study. It is limited to a description of the occurrence of a disease in a population. And the second is analytical study. It goes further by analyzing the relationship between health status and other variables. The second core study is the experimental studies. These studies are similar to experiments in other sciences in that they entail an active attempt to change a disease factor or the progression of a disease. The randomized control trial, which uses patient as subject, is the most common experimental design which is used. Other than that, field trials and community trials are the two other experimental studies in which the participants are healthy people, and for the community trials, sometimes the whole community is studied. So, before ending this unit, let's go over the main points discussed in this video. We had started off with understanding the meaning and concept of epidemiology. Then we moved on to discuss about the conditions which led to the development of a sub-branch of epidemiology called the social epidemiology. After discussing the relevance and the context of social epidemiology, we went on to discuss about the perspectives of social epidemiology. We have also discussed in detail regarding the various factors, the social factors and conditions affecting the body and health. And lastly, we went on to discuss the methods implemented by epidemiologists to study a disease and the social factors that are involved in it. With this, we come to the end of this topic, this video. Thank you, learners.